Now, some patients at the Manhyia Government Hospital are being discharged as nurses begin their indefinite strike demanding the sack of the regional NSS boss. Ms. Alex Opoku-Mensah is reported to have held insult at a nurse at the same facility for chastising his daughter, who is a medical officer at the Manhyia Government Hospital, over medication meant for a patient. The Ghana Registered Nurses and Midwives Association has since mounted pressure on government to dismiss the NSS boss for his unruly behavior. The NSS boss has since been suspended, but the Association of Nurses and Midwives is not satisfied. This morning, relatives of some patients at the surgical ward have been asked to take them home until the nurses resume work. My colleague Erastus Asaridonko is at the facility and joins us live with more. Erastus, what more can you tell us from where you are?
Okay, so the nurses at the Manhyia Government Hospital have carried out their threat to go on strike. We are currently at the surgical ward. As you can see, many of the patients have been asked to go home. A short while ago, we had motorcycles coming in to pick patients who cannot walk, and they've been given medications and been asked to treat them at home until the nurses resume. When you enter the main hospital here, emergency services are working, but then working partially, I must say, because there are doctors on duty. But then if the cases are severe, they wouldn't have any nurses to help them or assist them to take care of the patients. And so they will have to refer. And so currently, though the emergency unit is working, they are doing referrals to Komfo Teaching Hospital, Suntreso Government Hospital, and others until further notice. That is what is happening here. So the people you see here, these are relatives of patients who have come in to pick their patients out of the surgical unit. I'll try to get in here and speak with some of the relatives who are currently preparing their relatives to take them home. But there is this woman I would like us to focus attention on for a moment. Mama, yes, she doesn't want her face to show. She's telling me, yes, we will not be showing your face. She has a swollen leg.
But maybe with diabetes, more pressure. Let me walk, let me kikame. Musuman kika ho adebeti nyina na ohwaye kokokokoko na ayekuru na ayesa na medi ba Manhyia Hospital. Manhyia Hospital so ba yanje uska panie wo mimi wo panie bosum bia mi wo fo omo ma mi free ansa na eduro eni bibia nyina Manhyia ma mi free Sesi ayesi minkoshi minim de meye no me wo kapro kura me beto iduro minye bi na sedi me nan so aye no minim sedi meye enti me sra government me sra ni me de yankopo sra no Manhyia Hospital de ade e wo mo pe wanyama wo mo na wo mo nhwe ye do so wo ha na sesi a wo mo yin adwuma mi ti ho minim bebi a mekọ minim bebi a so meye no ho enti me sra no one share doctor so more hand.
So in basically what she's saying is that when she comes to the Manhyia Government Hospital, they have insurance and it covers treatment, the insurance covers treatment, and so they are not paying for injections, they are not paying for medication, and that is why they come here. Now she's been asked to go to another hospital. She doesn't have any money to go to another hospital. So she's appealing to government to attend to the needs of the nurses, let them come back to work so they can take care of her. And that is what she's saying, that she has diabetes, she has a swollen leg, and she cannot move anywhere. So when you come here, there are two doctors on duty. As you can see, they are working actively. But then they need the full support of nurses to be able to carry out the duty that they perform on a daily basis. And those nurses are absent at the moment, and that is why they are doing the discharges here. Let me try to get a sound bite from her. Doc, good morning.
Good morning.
How are you?
I'm fine.
What is happening here today?
Honestly, the nurses are saying if what they've demanded or what they want the government to do has not been done, they wouldn't come to work. So today, as it stands now, they've started their strike today. So we can't do the work alone. So we have to refer and then discharge the ones that are fine. Yeah. So that is what we've done.
So far, how many have you discharged?
About 6. And we've referred about 4. Yeah. To continue treatment in a different facility.
Do you think it's suitable looking at their conditions?
Not at all. It's not suitable at all. Because sometimes the facility they are being referred to also counts. Because some of them will end up getting like being reinfected or something if the wound is not being dressed the way it's supposed to be dressed. Yeah. So it's not fair on their side, on the patient's side. That's what I see.
And what she's saying is evident, what we saw in the morning, an elderly man who was being carried because he could not walk, and drips, he had drips on him, but they had to be taken and they had to bring in a motorcycle to carry him to the house. There's a gentleman standing here, and he has a patient here. You can see one being wheeled away at the moment. Yes, is that your grandma?
Yeah, that's my grandma.
What's her condition?
She was amputated and then he had an infection, so we have to bring her back. We brought her back. Yesterday, the doctor attended to her and then he's responding to treatment. She needs to be here for a couple of days, but then today we were called that we should come and take her to another hospital clinic, so we are doing that. That's why we're here.
So definitely she had amputation in the leg?
Sure.
And she's not in a good condition?
No. The leg got infected, so we have to bring her back. We brought her here. The doctor attended to her yesterday, and then she needs to be here for a couple of days so she can respond to treatment. And then today I was called to come and take her to another hospital. So I was just looking for a nearby private hospital so I can take her to.
How does that make you feel, looking at the strike, the issues at stake, and the condition of your mom and all that?
I have issue with what is going on. This is a mere simple issue that can be solved. Why are they dragging this? Just a verbal assault that leaders can solve this. I don't blame the nurses because they are just listening to what the authorities will tell them. So I don't blame them. They are just doing their jobs. But then leadership, what are you doing? We came here in the morning, we should discharge each and every patient irrespective of the person's condition. So are we saying those people should go and die? Is it the government we want? Is it the leadership we want? This, I think, me standing here can even resolve this issue. Me standing here. And a verbal assault. Why should you drag this thing? So if it should take like 3-4 days and then people start dying, is that what you want? Is that what Ghanaians want? Is that what we should get for our tax we've paid, for vote we've done? Is that what we should get? Ghana, we should set up. This is not fair. We should set up. This is not fair. Thank you. I don't have to say more because I am
definitely an emotional, relative of a patient who is in need of care, but cannot get that care and will have to go home because nurses are on strike for the verbal abuse, for invectives spewed on them by somebody who should be a leader and be managing them. Somebody who is taking care of youth under his leadership. So that is what is happening here at the Manhyia Government Hospital. There are doctors on duty, no nurses to attend to patients. Patients are being discharged to seek help elsewhere. Back to you in the studio.
one ward? Is it only specific to this ward or it affects the whole facility?
Well, Brace, we have the emergency unit behind us. It's quite a long walk from here, so I cannot walk with the TV on. But then, this is the surgical ward. There are other wards, emergency wards over there. Some patients have been discharged from there as well. Because without the nurses, on a daily basis, on a normal day, if you look at the number of nurses who attend to patients here at the Manhyia Government Hospital, it's quite enormous. So without any of them on site, it is difficult to take care of patients. And so they are discharging patients both at the emergency unit and in other wards as well. And so the only people on duty at the moment are doctors. And these doctors cannot administer care alone in this hospital. So it is not restricted to the surgical ward, but we have other wards as well being affected. Let's get out. There's quite emotions, anger, as relatives pick their patients out of this particular hospital. And you can see another vehicle in here trying to pick a patient out. Some of them have the means to try other hospitals. Some, they do not have the means at all. And it means that going home, there are two things involved. Either they get reinfected, die out of it, or hold on until the nurses come back so that they can get the care that they need. Brace.
Very interesting. Are we able to engage some of the people we see sitting behind you who are probably not happy with the situation? I hear them say a lot of things. Is it possible we can really gauge their mood as well?
Yes, definitely she's angry, and let me niawo kanwa pese etikakra dia na ma obo afu sesia sa
me pacho de papa ni ye de wanya de ya me ni nukure onya de chese wo ma ko strike ya ma mi na omuda hono no ye omubre ya ntimi hwe omu wa ba didi na ya ti o social media de wo ye ni wanya de kura wanya de ye mpenyin kasasa still nice power chow da we dey know da now kasa na udidi wo atem wanya de the way ne wanya de net for the power mo achow omon hu ye mame fo no mobo na mo behwe omon mai me de meka no.
What? So you're saying that the NSS boss did not do well? She has been listening to the tape on social media. He did not do well. The insults and all that did not go down well. But she's begging and appealing to the nurses to at least come back and take care of their moms and dads for her. That is what she has been saying. There are other people here. Let me try to speak with this lady. Mepato, say.
Yami adum. Eyen so enye. She said, even though Papa no he has not tried, but the patient should have, the nurses should have pity on our mothers and come and take care of them. My mother has a swollen leg. Now we have to be referred to another hospital, which is a huge problem. The problem is she cannot even walk. So what are they trying to do? We are now trying to find the means for transport and take her to other hospitals when there is a hospital near us where they can take good care of her. So please, the leaders, if it is Nanado or whoever, if it is World Health Organization, they should be involved and take care of the issue. If the man is to be sacked or suspended, they should do whatever it takes for them to come and take care of our parents, because we are all suffering. If our parents are not well, we cannot go to work. Right now, I'm supposed to be at work, but I'm here, seeing to my mother to be well taken care of, which is a huge problem.
Oh, you heard it. There are more people here who have come in. Some, they've come for treatment. Why are you here this morning?
Me pacho, me mama be surgery. Ye ni surgery ni we di week na ye nom say na ye me dressing. And ye buy and nurses ne cause strike. Me mama te ho nom na homa kra ye ntwen ba kompo. Oti woni nan kra se nyina hyehye ontimi nante ye buy say nurses wo ha. Enkom behwe nurses cause strike ni say doctors for nkom ntimi nya adwuma. Hospital hen na empty. Now kasa obani a doctor. Obani a doctor and doctors from community me adwuma. Nurses na ye adwuma no. Me see e beda ha. E kura kesi a nurses ni mi ano. Doctors for ntimi mi asa e kuro no. Me ma me ye surgery ya de ni beto. Nurses na hwe no. Oxygen si me ma me so sa be 4 days 5 days. Nurses for na hwe no.
Omu nyina ye adwuma bom. So in effect she's saying that her mom had surgery and currently they had to remove the strings and all that. Nothing has been done. Her legs, her feet are swollen and she's there. And she is trying to articulate the importance of nurses in taking care of these patients. And so that is what she's saying, that they all need the care that we are talking about. They are here and they are not getting the care because nurses are on strike. Brace.
Grateful to you. I'm sure you didn't see any of the nurses. You've not been able to speak to them as well, right?
Well, I saw some in the morning who had completed their morning shift and were heading home, but we are not having their replacements coming back. So they've all left.
Okay.
When we came, we saw about 2 of them who were leaving for their homes. But as of now, there is none here at the moment.
All right, I'm grateful to you. So that's my colleague Erastus Asare Donko joining us from the Manhyia Government Hospital, where the nurses are striking for that verbal abuse on their colleague last week by the Ashanti Region NSS boss. They are calling for his total dismissal.